हेलो एवरीवन एंड वेलकम बैक टू माय प्लेलिस्ट ऑफ फार्माकोलॉजी। लिपिनकॉट से हम कर रहे हैं और वो ड्रग्स जो स्किन सुपरफिशियल स्किन डिसऑर्डर्स में यूज होती हैं। आज का टॉपिक है द ड्रग्स विच आर यूज्ड टू ट्रीट रोजेशी। अब ये है क्या? रोजेशी इज अ कॉमन इन्फ्लेमेटरी कंडीशन अफेक्टिंग द सेंट्रल पोर्शन ऑफ द फेशियल स्किन। कॉमन क्लिनिकल फीचर्स इंक्लूड फेशियल इरिथमा, inflammatory lesions that are similar to acne. और ये मैं आपको जनरलाइज बता दूं कि इफ़ यू लुक एट द फेस ऑफ द पर्सन देन उसके चीक्स रेड होना, नोज रेड होना, दैट इज़ द कॉमन फीचर ऑफ रोजेशी। सो ये जो यहाँ पे वर्ड लिखा है ना कि फेशियल इरिथमा, सो यू सी रैश या रेडनिंग ऑफ द स्किन ऑफ द फेस एंड देन यू कैन ऑल्सो फाइंड एक्नी लाइक लीजन्स। तो आपको ऐसे पिंपल्स की तरह, दाने की तरह से लीजन भी दिख सकते हैं ऑल ओवर द फेस। The signs and symptoms and severity determine the treatment for this disorder. कितना ज़्यादा है उस पर बेस करेगा कि what treatment you have to choose. Azelaic acid is one potential treatment for rosacea. अभी हम दूसरे options भी देखेंगे. The other topical and oral products of rosacea are all described below. So let's start our discussion with brimonidine, which is an alpha-2 adrenoreceptor agonist. Very important. आपको बिल्कुल clearly पता होना चाहिए what do we exactly mean by this terminology, alpha-2 adrenoreceptor agonist. And it reduces erythema through vasoconstriction. Because it works on the alpha-2 adrenoreceptors, this particular drug, it causes vasoconstriction. And because the vasoconstriction is the main effect of this drug, you imagine the initial pathology was reddening of the face and facial erythema, so that is gone. So this is one of the treatment approach. It is available as a gel and its major adverse effects are burning, localized itching and warm feeling. And brimonidine ophthalmic solution is used for treatment of glaucoma as well for the same reason again, because it causing its effect on the vasculature. Then the next drug is doxycycline, and you know this is an antibacterial agent which is used orally in a very low dose, particularly for rosacea, where it exerts its effect on rosacea not by killing the bacteria but rather through its anti-inflammatory effect, because bacteria is not the primary issue in rosacea. In rosacea it's not an infectious problem, it's rather an inflammatory problem. It is available as a capsule and tablet, and its major adverse effect you know already from the antibiotic lectures: diarrhea, nausea, dyspepsia, even nasopharyngeal inflammation. So 2 drugs. Now these are all in addition to what we also use is azelaic acid. Okay, so we talked about brimonidine. You should know the mechanism of action. The other thing that we talked about is doxy, which is an antibiotic, but here it is utilized as an anti-inflammatory agent. Then metronidazole, it's another antibacterial agent that you have previously studied. It is believed to work in rosacea through anti-inflammatory and immunosuppressive effects rather than its antibacterial, because again, just like doxycycline, bacterial effects is not the matter of consideration here. It is available, metronidazole, as a cream, as a gel, as a lotion, and the major effects are burning. जो भी आप जब कभी टॉपिकल एप्लीकेशन कोई लगाते हैं, so initiate your thought process by कि उनकी वजह से कोई ना कोई irritation, burning, ये चीज़ें हो सकती हैं स्किन पर. Okay, even acne will carry rare side effects, but these can happen as well. Then the next one is oxymetazoline. This is now an alpha-1 adrenoreceptor agonist. Now compare this with the first one that you discussed, and that was an alpha-2 adrenoreceptor agonist, brimonidine. Now this particular drug is alpha-1 adrenoreceptor agonist, right? And it reduces erythema also through vasoconstriction, but through a different receptor. It is available as a cream, and its major effects include dermatitis and even worsening of the inflammatory region. So if the patients are not tolerating the drug well, stop the treatment immediately. Okay, burning sensation, erythema, pruritus, these are all itching effects, side effects caused by oxymetazoline. Then the next one is pimecrolimus. Now this is a topical calcineurin inhibitor, which is basically an immunosuppressant that decreases inflammation, also available as a cream. So these are all the options, and side effects are pretty much the same as any other topical agent would do. Now obviously when you see the patient with rosacea, it is also very important. This is not a pathology or medicine lecture, but I will just utilize a couple of minutes to throw the concept that if you see a person with erythema and there is a reddening of face here and perhaps on the nose, obviously you have to exclude other important medical conditions as well. So whatever causes facial erythema, there's a long list of differential diagnosis, and perhaps I would also include some autoimmune disorders such as SLE in the list. So you need to take a very good history, you need to take undertake a very good physical examination, and perhaps a few laboratory tests as well. So you need to make sure that anything else is not wrong. ये ना हो कि आप पता चले रोजेशी को ट्रीट कर रहे हैं और मसला को उससे थोड़ा सा बड़ा निकल आए. ठीक है. So please pay very nice attention to your patients, and the topic, however it may look simple, but it requires full attention. Okay, take care of yourself. आपसे मिलता हूँ अगली वीडियो में, जिसमें हम बात करेंगे अगले ग्रुप ऑफ ड्रग्स की which are basically used for pigmentation disorder. So take care of yourself till then.